Hi, this is Pat Dillon. This video will depict assessment of the integumentary system. Remember, when you do the integumentary system, keep in mind that if there are changes, oftentimes they are related to the endocrine system. Also, keep in mind that cancer cells are rapidly reproducing cells. So patients with cancer often have changes in their skin, hair, and nail, and chemotherapy often affects the skin, hair, and nail. So look for those changes. So before we begin, wash your hands. And introduce yourself to your patient. So hi, I'm Pat Dillon, and I'm going to be looking at your skin today, okay? So you're going to use two techniques of physical exam: inspection and palpation. Actually, the skin exam can occur throughout the entire physical assessment. We're going to focus on a couple key areas now. So you're going to look at the skin for color, and again, keeping in mind the age of the client and their ethnicity. So you're going to compare side to side, and you're going to look and palpate. You can inspect and palpate together at the same time. So what we're going to do is we're going to check for temperature, comparing side to side, colors consistent and uniform. We're going to look for any lesions. And if you identify a lesion, you want to measure that lesion and describe the lesion, and we'll talk about that in a minute. So we're doing temperature, the texture, it's smooth. Turgor, when you do turgor reflects hydration status. And so what we will do is do it on an unexposed area of the body. So we'll pinch up a little bit, and it should bounce right back if there is good skin turgor. So we've done temperature, texture, moisture, skin is dry, and we've done turgor. The other thing, as I said, is you're going to look for lesions. So there is a small discoloration of the area, flat macule noted here. And so what I would do is measure that lesion to note the size of it, and then I would describe it. So this would be about a 0.3 centimeter circular flat macule, brown in color. And the other thing you're going to do is look on the legs. And as I said, as you go through the assessment, you can do skin as you go through the different systems. The other thing you want to take note of is the nails, the condition of the nails. So the nails are in well manicured. You're going to check for capillary refill by pressing on the nail and releasing, and the color should come right back, which it does. And you can, if the patient should have nail polish on, you can always use the finger pads and do the same thing. Press on the nail pad, or the finger pad rather, and the color should return. All right, the other thing you want to take note of is the angle of attachment of the nail, which is the nail bed to the cuticle. And the way that you're going to do this is you're going to take your fingers, if you could put them like this, Zaire. And again, there is no clubbing. That's it, good. And the angle of attachment of the normal nail is 160 degrees. Clubbing occurs when it's 180 degrees. The other thing you'd want to note, if there is clubbing, they would have a bluish discoloration. So you're looking for any discoloration, but these are fine. The other thing that we're going to take a look at is the hair. And so I'm going to palpate a little. Let's see. So you're looking at, is it evenly distributed? Is it appropriate for their ethnicity, which it is? Any areas of alopecia? And there isn't. Any trouble with your scalp? Drying, flaky, anything like that, Sayur? No? Okay. So they're the things that you're looking for skin, hair, and nail. One of the things that I want to point out is if you find a lesion, you want to describe it if it's a primary or secondary lesion. A primary lesion is initial change in the skin. Secondary lesions are changes in primary, which either add to the tissue or take away. And you'll learn more about that in class. The other thing is you're going to look for vascular lesions, such as bruises, hemangiomas, choreangiomas, those types of things. And then the last thing that you want to note is, are there any suspicious lesions? So on this one area of discoloration, this macula that we identified on the hand, has that been there for a long time? Forever? Okay, good. So what you want to do is remember the A, B, C, D, E of your skin assessment for suspicious lesions. So A stands for asymmetry. Is the lesion asymmetrical? B stands for border, which is irregular border, but I also include bleeding because no lesion should spontaneously bleed. C stands for color. Has the color changed or is it multicolored? D stands for diameter, and diameter of a lesion shouldn't be greater than 1/2 centimeter. And E stands for elevation or enlarging. And so if the lesion has changed or it is growing, that would be suspicious. So the most common types of skin cancer that we see are basal cell, squamous cell, and then there's the melanoma. So basal cell and squamous cell most frequently occur on sun-exposed areas, so usually you find them on the head, neck, and then there's the melanoma occur anywhere on the body. So thank you so much.